My name is Aubrey. I'm 25 years old, and when I was 22, I had Roux-en-Y gastric bypass surgery with Dr. Sheila Partridge. I was 22 when I went ahead with surgery, and I was already 351 pounds, which put me at obviously high risk for diabetes, for high cholesterol, high blood pressure. Luckily, I didn't have comorbidities, but I was certainly on that route. And I remember at my physical that year, my primary care doctor said, "You'll be lucky to see 30 if you continue on the road you're on." So that obviously prompted me to take some serious measures, and I went to an informational session, and within a month of that session, I was really interested in surgery. Well, obviously we're located in Greater Boston, so there are tons of options. But when I weighed all of my options and I visited sort of all of the big centers in the area, I realized sort of we had a gem of a center here. It's in a community setting. It has excellent outcomes, and I think it was really just unparalleled compared to the other programs. And the other unique thing was that Newton-Wellesley, I feel, is really equipped to handle bariatric patients in a way that other medical centers aren't. The clinical outcomes drew me into the program. But really what kept me and what really, I guess, sold it for me was that it was the personalized care. When I walk into the door of this office, even 2 years after surgery, Denise says, "Hello, Aubrey." She knows my name. She knows who I am. She knows all about me. And everyone does. And they're my friends. And I think that, part of it is feeling, you're a patient here, but this is a sort of a family atmosphere. And they really care about you, not just as a patient, but as a person. Being a young person and being super morbidly obese has a lot of challenges. And so, for me, it was, I was young, I was fresh out of college, I was starting my career, which was all great. But, if you don't have your health in line, you can't really proceed with your life. So, simple things like climbing a flight of stairs or parking too far away in a parking lot, not fitting in movie theater seats or airline seats. Those are real concerns. And so when I hit that point, I realized this is no longer something I can try to manage on my own. This is something I need to get professional help doing. So that really prompted me to reach out and look for clinical options, which I hadn't before. So the Center for Weight Loss Surgery has a pretty rigorous set of measures that you have to take before you're ready for surgery, which is one of the things that drew me to the program, because I knew if they had taken the time to outline this program for me on the front end, that my success was first and foremost, that they wanted to see me through this whole process. There was a lot of work that had to go into, dieting, exercising, changing lifestyle ahead of time that would prepare me to handle the procedure and prepare me for that long-term success. I was always kept in the loop, whether it was my doctor communicating sort of, how from the time I signed up for the procedure to my surgery date to through my recovery, she was there along the way, personally making calls to me, always taking my calls when I paged her in the middle of the night to ask questions. And the entire office really worked that way. There's an extreme level of accessibility here. Definitely a learning curve after surgery, and they do their best to prepare you ahead of time. They give you all the information you need, and I studied as a very good student, but sometimes you just have to learn experientially. And so it was a lot of sort of testing the waters, because every patient's different. All of us are unique, so some people can tolerate things, other people can't. So you kind of run into those challenges. But the good thing is, because this office is so easily accessible, anytime I had an issue or I ate something and I thought, oh no, did I do something? They were a phone call away, in the middle of the night, in the middle of the workday, stopping by after lunch. I think I might have messed up. Can you help me? They were there. So yeah, it was definitely a hard adjustment period to figure out sort of what my new routine was going to be. And I think the biggest part for me was planning. So obviously my life has changed in extraordinary ways since surgery. So 2 years, 190 pounds lost. Before surgery, I'd wake up every morning with aching joints. 22, that's not a feeling you want to have. Now I wake up with aching joints because I'm active, and that's a great feeling to have. I couldn't climb a flight of stairs before I had my surgery, and a month ago I ran the Boston Marathon. So, that pretty much, that's coming full circle. Every day I carry my medal in my briefcase with me, because it reminds me, sort of how far I've come. And I think it keeps me in check in a lot of ways. Because if I want to continue on a lifestyle like that and I get to celebrate all of these little victories, that's going to keep me on the straight and narrow. Luckily, I didn't have the comorbidities that a lot of patients, especially people older than me, had, but they were eminent. And I've now, luckily, sort of cut those off at the pass, and I never will have to think about things like becoming diabetic or developing heart disease, which I was on track for at a much younger age than normal. So, the surgery saved my life in a real way.